So this week's lecture and quiz is on exercise and cancer. So first of all, I'm going to talk about what cancer is. Then I'm going to talk about how it's treated, which is really important to inform how we approach it from an exercise point of view. And then we're going to talk about how exercise is applied to treat cancer patients and survivors. So cancer is a very common condition. 1 in 3 Australians will be diagnosed with cancer by the age of 75, and half of us will be diagnosed with cancer by the age of 85. It's a leading cause of death in Australia, and more than 43,000 people die each year. Well, that's how many died in 2010. This is data from the USA, but it's very similar to Australian data. We can see that the most common cancers, this is cancer incidence, is prostate and lung, colon in men, followed by in women, breast, lung, and colon rectal cancer. So this is the incidence rate. So these are the most common, but then when we look at the cancers that cause the highest mortality and those that cause death, lung jumps up to the top above prostate and breast. Colon and rectal cancer is still there, but pancreatic cancer, which is way down the list in incidence, moves right up the list in terms of mortality because the survival for pancreatic cancer is only around 6 to 12 months. So what is cancer? Well, it's certainly a disease that people fear most. Survivorship is greatly improved through awareness campaigns. People are more aware of risk factors and different screening tools. Because of this, we get more early diagnosis, which means that the cancer is more treatable, and treatment has improved quite a lot over the years. Survival is increasing, so overall 5-year survival rate is over 60%, and in some cancers like prostate and breast cancer, 5-year survival is around the 90% mark or higher. But because diagnosis is improving and survival is increasing, the number of cancer survivors that we have in the community is increasing. So health professionals, including exercise physiologists and even exercise scientists, should understand this disease to be able to work effectively with patients. So cancer is a general term for abnormal, uncontrolled cell growth. It leads to tissue failure unless the abnormal cells are removed or destroyed. So what happens is cells are altered, so they no longer function normally. Normal cells have various rates of growth and division. They grow, they divide, and they die, as regulated by signaling pathways. And in some cases this mechanism fails. So there's a change or mutation in the DNA, which means that the cell grows larger than normal, or grows in a way where function is changed. Or it might just be simply, like in the case of lymphatic leukemia, the cells do not destruct and they don't die, and they hang around in this useless state without being destroyed and being recycled out of the body as normal. Now there's different types of tumours. Broadly, these are 3 different types. First is benign tumours. Now these are slow growing. They can get quite large. They tend to be larger than other types of tumours. But the thing about the benign tumours is that they're well organised and differentiated. So you can picture a benign tumour like a ball, where you've got a clear boundary of where the ball ends, and when it's sitting in normal tissue, you can clearly differentiate it from the normal tissue. It tends to be less destructive, although if they get big and heavy, they can cause damage to adjacent tissues and cause necrosis of that tissue, but they rarely cause death. The next type is a malignant tumour. Now these are tend to have the ability to kill the host tissue. These cells form from a malignant group of cells, and in contrast to the benign tumours, which are very well organised and differentiated from the surrounding tissue, these are highly unorganised, and they branch out like roots into the host tissue. They have lower sensitivity to drugs that treat them, and they're programmed for proliferation, which means that they tend to grow and spread. They invade the normal tissue, they tend to kill the host tissue, and they have increased invasiveness in terms of metastasis, which means that parts of these cells can break off and travel through the body to other parts of the system. And the third type we're talking about here is a metastases. So these are the development of a secondary malignant tumour originating from the primary tumour. So these tend to be a fair distance away in the body from the original tissue. They detach from the primary tumour, they go through either the circulation or the lymphatic system, they grab onto a new tissue and they proliferate. Lung is the most common site for secondary tumours, but also the bone and the brain. And they're always named for the site of the primary tumour. So if someone has breast cancer and that breast cancer is malignant and it spreads, ends up in the brain, for example, they don't have a brain tumour, they have a breast cancer metastasis on the brain. Same as if it spreads to the lung, it's not lung cancer, it's a secondary cancer or metastasis of the breast cancer, or the prostate cancer, or wherever it originated. Now there are different types of cancer, and I'm not going to go into too much detail in this lecture. Carcinomas are solid tumours that develop in epithelial cells or the tissue lining, and most cancers are carcinomas, 85 to 90%. Melanomas are cancerous growth of the melanocytes, which is the pigment producing cells, most commonly on the skin but in other tissues as well. Sarcomas are solid tumours like carcinomas. They originate in connective tissue like bone, muscle, cartilage and fat, but these are a very rare type of cancer. And then there's leukemias, which is cancer of blood forming organs, which results in abnormal white blood cells. So cancer is staged. So if you come across a cancer patient or survivor, the stage of cancer will be described. There's a number of different ways, but one of the common ways is the T&M system. So T stands for tumour size, so you get a rating of 1, 2 or 3. The lymph nodes, again, if it does involve the lymph nodes, no is a 1, no or yes just on the same side can be a 2, yes on the same side is a 3. And metastases, if there's distal metastases, that automatically makes it a stage 4. So you can see in the example that lung cancer, someone with a small tumour less than 2 centimetres, no lymph nodes, no metastases, they're stage 1. The other example there is breast cancer. You can see that the M is positive, so that makes it stage 4. Doesn't matter how large or whether the lymph nodes are involved. And the lymph nodes are going to be involved if it's a metastases, but it doesn't matter in this case in terms of staging. So there's many different types of cancer, and they're all, many of them are quite different from each other. For example, if we're just to talk about lung cancer itself, we've got non-small cell lung cancer, small cell lung cancer, large cell lung cancer. We've got different genetic factors that might be present which affect the way that the cancer is treated. We've got mesothelioma, we've got cancer of the pleural lining, and depending on the stages of the cancer and what type of cancer you've got, this is going to change the way it's treated, and therefore the way the patient's going to present if you're treating them with exercise.